My name is Julie. I'm a second-year family medicine resident here at Penn. I was also at Penn as a medical student. I graduated in 2020, the height of COVID. When I was in med school, I became first interested in medications for opiate use disorder when I worked with Prevention Point as part of the Bridging the Gaps summer internship program, and I saw the value of how connections to care matter, and also how, as a medical student, sometimes the best role I could play on the wards was advocating for patients to be connected to care for their opiate use, and also to advocate for the use of medications for opiate use disorder. I think now as a resident, one of the great things about family medicine is that we work in a variety of different contexts. So we work on the labor floor, we work in the ED, we work inpatient, we work outpatient, we do prenatal care, we do community medicine. And I can't think of a single context that learning about medications for opiate use disorder hasn't been useful. I think especially when we think about oftentimes the most effective first step in any sort of treatment plan is addressing a patient goal of getting access to care for their opiate use disorder or treating that opiate use disorder. And it can make all the difference between a patient staying in the hospital or leaving, staying in the ED or leaving, or continuing with their prenatal care for a safe and healthy pregnancy. And I can think of a couple of instances inpatient on our service at Penn Presbyterian where we were able to help start patients who identified wanting treatment for their opiate use disorder with access to that treatment, and then they were able to follow up in our MOUD clinic at Penn Family Care, and now they're just part of our regular patient panel there and are doing quite well. And so it's particularly rewarding, I think, as a young provider and as a former med student, to be able to have access to this information, even if you're not prescribing yourself, but to be able to advocate for better care for your patient. And just as we learn how to prescribe antihypertensives or diabetes medications, I think this is just another useful tool to learning how to help our patients. I think as a med student and even as a resident, I've often been surprised at how many faculty, newer or older faculty, are less familiar with medications for opiate use disorder, when oftentimes it can be the most important thing we can do for our patients in the hospital or outpatient. And I think one of the most important things you can do now in the immediate, even if you won't be prescribing these medications until the future, is to be informed about how these medications work, be informed about when you can start them, and also be informed on harm reduction. And that's what the X-Waiver training will give you.